This is Dr. Amjad Dafalla, Tuskegee University, College of Veterinary Medicine. In this dissection series, I'm going to follow the same sequence and the same order that you have in your guide to the dissection of the dog by Evans and De La Hunter to make it easy for you to follow me up. The best way to utilize these videos is to review them before coming to the class. Also, you can utilize them during your dissection class, and you can utilize them as a review after class. I will try my best to combine all the information that we discuss during lecture with that we discuss through the dissection class, so you will have the complete picture. On another series, I'm going to have a separate dissection video aiming mainly towards the surgical approach to each area, either the joints or the bones of the forelimb and the hind limb, and surgical approaches to the thorax and to the abdomen and to the pelvis. This is going to be a separate series. The purpose of all these digital dissection series is to help you through your first year, to help you comprehend and understand the subject matter of gross anatomy, to have a very good grasp of the topographical relationship of structures to each other and organs to organs. This will gonna come very handy when you go to your clinical years dealing with clinical cases and surgical procedures. So the whole purpose of this is I want you to have a better understanding on how the canine body is formed, the spine of the scapula and the acromion, which is at the distal end of the spine of the scapula. This point here, or this dot here, represent the point of the shoulder. This is the great tubercle of the humerus. Another structure I want to draw your attention to is this structure here, this point here. This is the olecranon tuberosity of the ulnar. This is the point of the elbow. Also, it is one of the structures that you can palpate in the live animal. Bear in mind, the point of the elbow is always against the fifth rib or the fifth intercostal space. This will come handy when you come to do lung auscultation or heart auscultation. You will utilize the point of the elbow or the olecranon tuberosity as the landmark for auscultation of the heart and the lung. Another structure that you can also palpate is the wing of the atlas, which is located here. Also, you can feel it at this point here. This is the wings of the atlas. Also, it is one of the structures that you can palpate. Now, when you come to start your dissection, you need to make an incision from the cranial aspect of the neck all the way to the umbilicus. From the umbilicus, you make a transverse cut all the way to the mid-dorsal line. Then you come to your cranial end of your previous cut, and you do another transverse cut all the way to the mid-dorsal line, going just caudal to the ear. When you come to the level of the sternum here and against the arm, you make another cut from this level here at the mid-ventral line all the way to the elbow joint, and you make a circular cut. Then you're gonna reflect the skin to the mid-dorsal line. In this dissection, when I reflect the skin, I'm gonna reflect the skin from the whole limb. But if you wanna follow your dissection manual, first they ask you to do your cut all the way up to the elbow and then reflect the skin. As I said before, I'm gonna follow the sequence and the order you have in your dissection manual, which means I'm gonna start with the Synsarcosis muscle, which is the extrinsic muscle. Those are the muscles that attach the forelimb to the trunk. Again, between the trunk and the forelimb, there is no conventional joint. The attachment is achieved through muscles. These muscles, we refer to them as Synsarcosis muscle or extrinsic muscle. These muscles, they have one attachment on the appendicular skeleton, which is the bone, one of the bones that form the limb, and the other attachment is to the axial skeleton. Axial skeleton, it is either the head or the vertebral column. Now, when you do your cut and reflect the skin, you are gonna encounter the subcutaneous tissue. This is a very loose areolar tissue. Mainly it is filled with fat. In your specimens, it may look like a little bit glistening area with the embalming solution. It will dissolve the fat a little bit. Okay. When you reflect the skin, okay, now you will reveal the fascia. And the fascia, there are a superficial fascia and a deep fascia. The superficial fascia and the deep fascia, both of them are dense, fibrous, connective tissue. The superficial fascia represents the last or the most inner layer of the subcutaneous tissues. The deep fascia is intimately attached to the muscle's fibers. Okay? When you start removing this fascia to expose the muscle and the demarcation between the muscles, we call that you are cleaning the muscles. So let us start cleaning and reveal the muscle that we're gonna dissect. So as soon as you reflect the skin and you start cleaning the muscles around the shoulder and the neck area, okay, that's how it looks. In this one, we took the fascia out, we clean the muscle. You will encounter this muscle here that is attached to the skin. Most of the time, when you reflect the skin, it will come attached to the skin. This is the cutaneous tronchi muscle. This is the cutaneous muscle of the trunk. When we say trunk, we mean the thorax and the abdomen of the animal is the trunk. So this is the cutaneous muscle. Okay. You will see it here. Okay. It's the thin muscle. It is the muscle that twitches the skin. This muscle is innervated by the lateral thoracic nerve from the brachial plexus. The same extension of this muscle to the neck and the head, we call it the platysma. Also, you will see part of it here and you will see part of it in the neck area. And when we go to the head and reflect the skin from the head, also you will see that extension. So, the cutaneous skin of the trunk, which is the thorax and the abdomen, is the cutaneous tronchi. It is this muscle here. This muscle is responsible for twitching the skin. The same extension of the cutaneous muscle to the neck and to the head, we name it the platysma. Also, it is attached to the skin here. Now, to continue with the cutaneous tronchi muscles, as I said earlier, this muscle extends on the mid-ventral aspect of the abdomen. In the male dog, okay, the cutaneous tronchi muscle will gonna go and form the preputial muscle. This is the penis, and this is the prepuce. Okay, I reflect the prepuce to show you the preputial muscle, which is the caudal ventral extension of the cutaneous tronchi. This preputial muscle, it will tend to draw the prepuce over to cover the penis and the glans penis after surface. So bear in mind the cutaneous tronchi, which is the skin at the level of the trunk and the neck, and the platysma at the level of the neck and the head, both of them, which is the skin. The caudal extension of the same cutaneous tronchi muscle will form the preputial muscle in the male dog, and that is the muscle that draw the prepuce over the glans penis after surface. Okay, now we reflect the skin. The first muscle that you're going to encounter is the cutaneous tronchi. As the name implies, it is the muscle of the skin, cutaneous tronchi. It is the cutaneous muscle of the trunk. When we say the trunk of the animal, we mean the thorax and the abdomen. This is a cutaneous muscle, so when you reflect the skin, you will see it is attached to the skin. Maybe a small piece may be left in the body, but most of the muscle fibers will going to be reflected in the skin. You can see it over here. This is the cutaneous tronchi muscle. This is the muscle that covers the dorsal aspect of the body, the lateral aspect of the thorax and the abdomen, and all the way it will extend to the mid-ventral line of the thorax and the abdomen. Now, the same cranial extension of this cutaneous muscle that covers the neck and the head, it is the platysma. So the same cutaneous muscle at the level of the trunk and the abdomen, we call it cutaneous tronchi. At the level of the neck and the head, we call it the platysma. Okay, this is the platysma. I left this part here on the body so you can see it. You can see that its fibers run cranio-ventrally. Okay, all these are cutaneous muscle. These muscles tend to twitch the skin. These muscles are innervated by the lateral thoracic nerve, which is coming from the brachial plexus. Now we're going to move to the extrinsic muscle, which is the Synsarcosis muscle. The first one we're going to start with, let me go to the skeleton here. We're going to start with the superficial pectoral and the deep pectoral. Before we look at them, now, this is the sternum. This is the forearm. This is the scapula and the humerus and the antebrachium. The superficial pectoral muscle originate from the cranial aspect of the sternum and insert on the teres minor and the teres major and the teres minor tuberosity of the humerus. So you can say it is coming from the cranial aspect of the sternum and insert on the proximal part of the humerus. There is the superficial pectoral and there is the deep pectoral muscles. So the superficial will come from the first sternibri, which is the first segments of the sternum, and attach to the proximal aspect of the humerus. So when this muscle contracts, it will tend to do what? It will tend to adduct the forelimb to the trunk. It will bring the forelimb closer to the trunk. This is when the animal is not bearing weight. When the animal is bearing weight, with the heavy weight of the animal, this muscle will tend to prevent abduction of the limb. Now, let us go and look at these muscles. Now, okay, this is the sternum. This is the cranial part of the sternum. You know the sternum consists of 8 sternibri. The first one is the manubrium. Now, if you look here, this whole muscle here is the superficial pectoral muscles. It has two parts. The smaller, most ventral part, which is this part here, this is the descending pectoral, superficial part. The thin, wider portion, this is the transverse pectoral. Both of them together, they will form the superficial pectoral muscles. The descending superficial pectoral originate from the manubrium, which is the first segment of the sternum, and attached to the proximal part of the humerus. The transverse originate from the first 2 or 3 sternibri, or first or 2, 3 segments of the sternum, and also attached to the proximal part of the humerus. Both of them, when they contract, they adduct the forelimb, bring the forelimb closer to the trunk. When the animal is bearing weight with the heavy weight, they prevent abduction of the forelimb. Now, the second muscle that we're going to dissect is the deep pectoral. This is the deep pectoral muscle. The deep originate from the whole length of the sternum, and also it go and insert on the proximal part of the humerus. It has the same function as the superficial, although it is larger and it is bigger. And here I want to draw your attention that the deep pectoral muscles consist of 2 portions. So don't get confused. Both of these together is form the deep pectoral. In another terms, you can say that the deep pectoral, it has 2 bellies. One is ventral to the other one. Okay. The function of the deep pectoral is very similar to the superficial. It will originate from the whole length of the sternum and attach to the proximal aspect of the humerus. It's the larger muscles, and it is stronger muscles, and it is one of the muscles that sling the trunk in between the two limbs. Now, we're done with the superficial pectoral, we're done with the deep. I'll stop it here. Now let us continue with the deep pectoral. The deep pectoral originate from the whole length of the sternum, from all 8 segments of the sternum, and insert on the teres major and the teres minor tuberosity of the humerus. So this whole muscle here is the deep pectoral. It's larger and stronger than the superficial. I want to draw your attention that the deep pectoral consists of 2 parts. So don't get confused about that. Both of these, okay, this one part and this one part, both of them form the deep pectoral. So the superficial pectoral muscle has 2 parts, a transverse, wider and thinner, and a smaller ventral descending. The deep pectoral, it has 2 bellies, this one and this one. Now, from the deep pectoral, we move to the Brachiocephalicus muscle. Okay? We are still discussing the extrinsic muscle or the Synsarcosis muscle. And for any muscles to qualify to be considered as an extrinsic muscle or as an Synsarcosis muscle, it must have one attachment to the appendicular skeleton and one attachment to the axial skeleton. Axial skeleton is either the skull or the vertebral column or the ribs or the sternum, and one attachment to one of the bones of the appendages of the limbs. Okay? So we said that the first one, the superficial pectoral and the deep pectoral. Now we come to the Brachiocephalicus muscle. This is the Brachiocephalicus muscle. Okay? As the name implies, this is the muscle that extends from the brachium, which is the humerus, and go all the way to the cephalic, which is the skull. I want you to pay attention that this muscle is not only attached to the skull, it also has one attachment to the neck. Okay? Now, if you look at this muscle here, okay, I want to draw your attention to this white line here. This is the clavicular intersection. In dogs and cats, the clavicle is reduced, is vestigial, it is not developed. It is being reduced to a cartilaginous plate. You can feel it at this level here. This is the clavicular intersection. If you press, you will feel a tiny cartilaginous structure that represents the reduced clavicle. That's why they provide this muscle with another name, Cleidocephalicus. Cleido means clavicle. Anatomists, they consider the clavicle to be the origin of this muscle. So the part of the muscle that extends from the clavicular intersection to the humerus, they call it cleidobrachialis. And the part that extends from the clavicular intersection to the head, they refer to it as cleidocephalicus. Okay? Or you can still call it brachiocephalicus. Now, the insertion of this muscle, you will realize that there are two parts of this muscle. The part that go and insert on the dorsal midriff of the neck, that is the cervical part of the Brachiocephalicus, or they call it the Cleidocervicis or the Cleidocervicalis or pars cervicalis. Okay? If you look here, there is another part. Okay? This part will go all the way to insert on the mastoid process in the skull at the temporal bone. So this is the Cleidomastoideus, this is the Cleidocervicis or the Cleidocervicalis. The Brachiocephalicus muscle function depends on the scenario. There are two scenarios. When the animal is standing and the forelimb is fixed on the ground, this muscle, when it contracts, it will tend to move the head and the neck to the side. If both limbs, the left and the right limbs, are fixed on the ground and both sides of the Brachiocephalicus contract, this will move the head down. It will draw the head downward. Now, let us take the other scenario when the limb is off the ground. In this case, when the Brachiocephalicus muscle contract, it will advance the limb. It will move the limb forward. By doing that, it will extend the shoulder joint. Now, let us move to another muscle of the Synsarcosis. This is a big muscle. It is coming from the mid-dorsal line and also insert on the humerus. This is the Latissimus dorsi muscle or the Latissimus dorsi muscle. This is a huge muscle. Okay? It is coming, if you can see, if you can focus here. Okay. Now we move to another muscle of the Synsarcosis, which is the Latissimus dorsi muscle or the Latissimus dorsi. It is this muscle here. This muscle is huge. It is coming from the mid-dorsal aspect here. The white glistening area you see here, this is a modified deep fascia We call it thoracolumbar fascia, at the level of the thorax and the lumbar region. So this is the thoracolumbar fascia. It covers the muscle of the back, okay, and also it provides an origin for the latissimus dorsi muscle. All this is the latissimus dorsi or the latissimus dorsi muscles. This is the muscle that when it contracts, it will move the forelimb backward. So every time when you see the dog is digging, the major muscle that is working is the latissimus dorsi or the latissimus dorsi muscle. It is this muscle here. You can miss it. Now, I want to draw your attention to this muscle here, to this strip here. And this always causes confusion with the student. This is not part of the latissimus dorsi muscle, okay? This is part of the insertion of the cutaneous tronchi muscle that we talked about earlier. Also, it has one insertion here combined with that of the latissimus dorsi. So the small piece that you see at the top or lateral to the latissimus dorsi, this is strip here, this is part of insertion of the cutaneous tronchi muscle. Now, another muscle is the trapezius. And the trapezius, it has two parts. This is the trapezius. It has two parts. Okay? It is coming from the mid-dorsal raphe of the neck and the thorax and insert on the dorsal aspect of the scapula and the scapular spine. This is the cervical part of the trapezius. This is here, okay, is the thoracic part of the trapezius. Okay? Let me show it to you in a larger specimen so you can see it better. Let us go to the other specimen. This is the trapezius. This is the cervical part of the trapezius. And this is the thoracic part of the trapezius. Okay? We refer to it as the thoracic part because it originates from the dorsal aspect of the thorax. And this is the cervical part because it is originating from the neck. Okay? So, all this triangular muscle, okay, insert on the dorsal aspect of the scapula and the spine of the scapula. This is the trapezius, cervical part, trapezius, thoracic part. Now, when the trapezius contract, okay, it will elevate the scapula up. Okay? Now, we move to another extrinsic muscle, a muscle that originate from the spine of the scapula and insert on the transverse process of the atlas or the wing of the atlas. The atlas, this is the first cervical vertebra. Okay? So this muscle here is the omotransversarius. Omotransversarius, originating from the spine of the scapula and go and insert on the wings of the atlas. Now, the omotransversarius, on its medial side, okay, there is the big lymph node. Okay? I hope you can see this. This is the superficial cervical lymph nodes. These are one of the lymph nodes that you can palpate during your physical exam. This superficial cervical drain the lymph from the proximal aspect of the limb and the superficial structure of the neck. So if there is any infection or if there is any inflammatory process going at the superficial level of the neck or the proximal part of the forelimb, this lymph node will be enlarged. Okay? Usually this lymph node just sitting cranial to the shoulder. Okay? So usually there are 2 or 3 of them. Okay? This is the superficial cervical lymph node. Always we utilize the omotransversalis muscle as the landmark for this superficial cervical lymph node. Usually you'll see one here and another one here. Okay, this is a very good size one. Okay, if it is not inflamed, sometimes it is hard to palpate, but if it is inflamed, you can easily palpate it cranial to the shoulder. Now, based on the attachment of the omotransversalis, when it contracts, also it will do what? It will advance the limb. It will move the limb forward. Now, omotransversalis, trapezius, once we are in this area here, okay, now I'm gonna mention another 3 muscles. These muscles are not part of the extrinsic muscles. They are not part of the Synsarcosis. Why? Because the Synsarcosis muscle or the extrinsic muscle, they must have one attachment to the limb and another attachment to the axial skeleton, which is either the head or the vertebral column or the sternum or the ribs. These 3 muscles that I'm going to discuss now, because of the proximity to the area, because we are dissecting within the area, so I'm going to mention them, but make sure that you understand these muscles are not part of the Synsarcosis. These are the Sternocephalicus muscle, the Sternal muscle, and the Sternal Thyroidis muscle. Now, again, these muscles, we are just discussing them because we are in the area. They are not part of the Synsarcosis muscle, okay? You must have that distinction in mind. Now, let us take the Sternocephalicus. When you look at the name, sterno means sternum, cephalicus means head. So it is the muscle that extends from the sternum to the head. Now, the Sternocephalicus muscle, it has 2 parts. It has one part go and insert on the occipital bone of the skull. This is the occipital part of the Sternocephalicus. It has another part that go to the mastoid process of the temporal bone. Okay. It will insert there with the mastoid part of the Brachiocephalicus that we discussed earlier. So if you flip the Sternocephalicus, you're going to be able to see the mastoid part better, because you can see the demarcation here. Okay, so this is the mastoid part of the Sternocephalicus. Go and insert to the mastoid process together with the mastoid part of the Brachiocephalicus. Okay, the part that you see here, this is the occipital part of the Sternocephalicus. Now, I want to draw your attention to this structure here that run in between the Brachiocephalicus muscle dorsally and the Sternocephalicus muscle ventrally. This is the external jugular vein. This is one of the veins that you can utilize for venipuncture in dogs and cats. If you want to give IV injections or if you want to draw blood, you can utilize the external jugular vein. It runs superficially, okay, in between the Brachiocephalicus dorsally and the Sternocephalicus ventrally. Now, let us dig and go deeper. This is the trachea, and you can see the rings of the trachea. Okay? Now, the muscle that's sitting on the ventral aspect of the trachea, it is coming from the manubrium, which is the first segment of the sternum, and insert on the basihyoid bone. This is the Sternohyoideus muscle. This is the Sternohyoideus muscle. Okay? Now, this is the Sternohyoideus muscle. It is coming from the sternum, and it go and insert on the basihyoid bone. Okay? Now, this muscle, Sternohyoideus, when it contracts, it will draw the tongue backward. The other one is on the side. It is the Sternal Thyroidis, originate from the manubrium, the first segment of the sternum, and insert on the thyroid cartilage of the larynx, here, at this level here. This is the Sternothyroidis. So the one on the ventral aspect, sitting immediately ventral to the trachea, is the Sternohyoideus. The one on the side, that attached to the thyroid cartilage of the larynx, this is the Sternothyroideus. Both of these muscles, when they contract, they draw the tongue and the larynx caudal. Now, hence we are here. If you go caudal or ventral to the larynx, this is the larynx. You can feel the cartilage of the larynx. The larynx is the vocal box. Okay? Ventral to it, this structure here, this is the thyroid gland. There is one on the right and there is another one on the left. Okay? This is the thyroid gland. Now, once we are deep here, between the esophagus and the trachea, there is this structure here which is covered by modified deep fascia. This is the carotid sheath. Let me open it and let us see what is inside there. When we open the carotid sheath, let us remove it. Okay. This pink structure that you see inside the carotid sheath, this is the common carotid artery. Now, the small vein that you see running within the carotid sheath, let me separate it here. Okay. This is the internal jugular vein. Don't confuse the external jugular vein, which is superficial, to the internal jugular vein, is small and run within the carotid sheath. Now, on the dorsal aspect of the common carotid artery, there is a big nerve trunk attached to the dorsal aspect, and this is the vagosympathetic trunk. Okay, so now we open the carotid sheath. We said the carotid sheath is the modified deep fascia that wraps around the common carotid artery, the vagosympathetic trunk, the internal jugular vein, and a tracheal duct. A tracheal duct, this is a tiny lymphatic duct. Okay, sometimes after the animal dies, this lymphatic duct collapses, so you're not going to be able to see it in all specimens. But fortunate enough, in this specimen, we can see the thoracic duct, which is this structure here. Okay, it is brownish in color. I don't want to pull hard on it, okay, because it will break. Okay, if you can focus here a little bit. Okay, this is the tracheal duct, which is a lymphatic duct. So the carotid sheath is covering the common carotid artery, the vagosympathetic trunk, the internal jugular vein, and the tracheal lymphatic duct. Okay? Now, we said the carotid sheath is modified deep fascia. If you go back to the external jugular vein is wrapped with superficial fascia because, as I said earlier, the external jugular vein is run superficially under the skin in between the Brachiocephalicus and the Sternocephalicus. Now we're going to continue with the extrinsic muscles. What I'm going to do here, I cut the cervical part of the Brachiocephalicus and I'm going to reflect it dorsally. Also, I transect the cervical part of the trapezius. I'm going to reflect the top part also dorsally. And I also transected the thoracic part of the trapezius, and I'm going to reflect it also dorsally. This will expose this muscle here, sitting underneath the trapezius and the cervical part of the Brachiocephalicus. This is the Rhomboideus. The Rhomboideus extends originating from the dorsal aspect of the scapula and go and attach to the back of the head. The Rhomboideus at its origin, it has two parts, but the demarcation between these two parts, you can't see it, it's very hard to separate them. When you go cranially, clearly you can see the demarcation between the capitis part of the Rhomboideus and the cervical part of the Rhomboideus. That means the Rhomboideus has two parts. The dorsal one, which is originating from the mid-dorsal raphe, this is the cervical part of the Rhomboideus. The one on the side, this is the Rhomboideus capitis, which is the second part of the Rhomboideus. There is a third part, which is the Rhomboideus thoracicus, or the thoracic part of the Rhomboideus. Unfortunately, I can't show it to you in this specimen. I will show it to you in another specimen. This is going to take us to the next muscle, which is the last muscle of the extrinsic muscle that we're going to discuss, which is the serratus ventralis muscle. The serratus ventralis is this muscle here. It's a huge muscle. It has a cervical part and it has a thoracic part. Okay? When you remove the limb, you will realize that this muscle with these two portions will going to form like a fan-like structure. So again, this is the serratus ventralis cervicis, or the cervical part of the serratus ventralis. This part here is the serratus ventralis thoracicus, or the thoracic part of the serratus ventralis. This muscle, the serratus ventralis, with the superficial and the deep pectoral, they sling the heavy weight of the trunk in between the two limbs. By this, we're going to come to the end of the extrinsic muscle. To do a review of all of them, we start with the superficial and the deep pectoral, the Brachiocephalicus muscle, the omotransversalis muscle, the trapezius muscle, the Rhomboideus muscle, and the Latissimus dorsi muscles, and the serratus ventralis muscle. All these muscles represent the extrinsic muscles. We also discussed three muscles. Those are the Sternocephalicus muscle, and the Sternohyoideus muscle, and the Sternal Thyroidis muscle. And I said these three muscles, we don't consider them as extrinsic or a Synsarcosis muscle, because both their attachment is to the axial skeleton. They start from the sternum and they insert on the head. So origin from axial skeleton, insertion on axial skeleton, so they don't qualify as extrinsic muscle. I said we mention them because we are dissecting within the area and they are located there, so we mention them as well. I hope this will wrap all the extrinsic muscles. Next, we're going to go to the intrinsic muscle. And the intrinsic muscles, those are the muscles that originate from one part of the bone of the forelimb and insert on another part within the forelimb itself, which means origin and insertion, both of them are within the appendicular skeleton of the forelimb. I'm going to do them in group. We're going to take the muscle that work or act on the shoulder joint. Then we're going to move to the muscle that act on the elbow joint. Then we're going to move and discuss the muscle that act on the corpus and the digital joints. Thank you.